Welcome back. In this lesson, we're looking at AI use cases in healthcare industry. AI/machine learning educational explainer. Now let's look at introduction. Artificial intelligence is becoming one of the most important forces shaping the healthcare industry. It is helping healthcare organizations move from reactive care to more proactive, personalized, and efficient care. AI can analyze large volumes of clinical, operational, financial, and patient-generated data much faster than humans alone. But AI in healthcare is not just one thing. It includes predictive models, grounded knowledge assistants, and intelligent agents that help orchestrate work. In this video, we will explore the major AI use cases in healthcare, current trends, and a simple three-bucket framework to understand where AI creates value. Now let's look at what this video covers. In this video, we will first understand why AI matters in healthcare and what trends are shaping the industry today. Then we will group healthcare AI use cases into three practical buckets. The first bucket is AI and machine learning for prediction. The second bucket is RAG, or Retrieval Augmented Generation, for grounded answers. The third bucket is agents for orchestrated work. After that, we will go through one slide on each major use case and end with a short recap. Now let's look at current trends in healthcare AI. Several trends are shaping the current healthcare AI landscape. Healthcare organizations are moving beyond pilots and focusing more on measurable clinical and operational value. Generative AI is being used for documentation, knowledge support, patient communication, and administrative automation. Multimodal AI is gaining importance because healthcare data includes text, images, signals, documents, and structured records. AI governance, privacy, compliance, model monitoring, and human oversight are becoming essential, not optional. Another important trend is the move toward workflow-integrated AI, where tools fit directly into clinician, operations, and patient service processes. Now let's look at three buckets of healthcare AI use cases. A simple way to understand healthcare AI use cases is to group them into three buckets. Bucket 1 is AI and machine learning for prediction. These use cases predict risk, classify conditions, detect patterns, and forecast outcomes. Bucket 2 is RAG for grounded answers. These use cases combine a language model with trusted sources such as clinical guidelines, hospital policies, and medical documents. Bucket 3 is agents for orchestrated work. These use cases do not just answer questions, they coordinate steps, systems, people, and actions across a workflow. Now let's look at use case 1, disease risk prediction and risk stratification. The first major use case is disease risk prediction. AI and machine learning models can analyze patient history, lab values, medications, demographics, and prior events to estimate future risk. Examples include predicting diabetes complications, heart failure risk, chronic disease progression, and likelihood of hospital admission. This helps healthcare teams identify high-risk patients earlier. It also supports preventive care, targeted intervention, and better resource allocation. In simple terms, this use case helps healthcare organizations act before the problem becomes more serious. Now let's look at use case 2, diagnostic support in imaging and clinical detection. Another major predictive use case is diagnostic support. AI models can analyze medical images such as X-rays, CT scans, MRI scans, mammograms, retinal scans, and pathology slides. They help detect patterns linked to cancer, fractures, stroke, pneumonia, diabetic retinopathy, and other conditions. These systems do not replace clinicians, but they can help improve speed, consistency, and early detection. AI can also support clinical detection from ECG signals, lab trends, or digital biomarkers. This makes predictive AI valuable in both radiology-heavy and non-imaging clinical settings. Now let's look at use case 3, clinical deterioration, sepsis, and ICU risk prediction. A third major predictive use case is early warning and deterioration detection. AI models can continuously monitor vitals, nursing assessments, lab values, and patient history to estimate whether a patient is getting worse. Hospitals use such models to detect sepsis risk, ICU transfer risk, cardiac events, and general clinical deterioration. The purpose is to alert care teams early enough for faster intervention. This can improve patient safety and reduce avoidable complications. It is especially useful in emergency departments, inpatient wards, critical care, and remote patient monitoring settings. Now let's look at use case 4, operational prediction and capacity forecasting. AI is also valuable for healthcare operations. Hospitals and payers can predict readmission risk, no-show probability, length of stay, bed demand, discharge timing, staffing needs, and claims workload. These predictions help organizations plan capacity more effectively. For example, a hospital can forecast bed occupancy and improve flow across departments. A clinic can predict which patients are likely to miss appointments and intervene early. This kind of AI improves efficiency, cost control, and patient experience at the same time. Now let's look at use case 5, RAG for clinician knowledge and decision support. Now let us move to the second bucket, RAG for grounded answers. A clinician knowledge assistant can combine a language model with trusted medical sources such as treatment guidelines, internal protocols, formularies, pathways, and hospital SOPs. When a doctor or nurse asks a question, the system retrieves relevant source material and generates a grounded answer. This is useful for protocol lookup, order guidance, drug information, and clinical reference support. The key advantage is that the answer is based on approved content, not only on the model's memory. That improves trust, traceability, and usability in healthcare settings. Now let's look at use case 6, RAG for patient education and discharge guidance. RAG is also powerful for patient-facing education. Healthcare organizations can use it to generate simple, personalized, and grounded answers from approved content. Examples include discharge instructions, pre-procedure preparation, medication guidance, insurance FAQs, and chronic disease self-care information. The system can retrieve approved documents and then explain them in simpler language for the patient. This helps improve understanding, adherence, and patient satisfaction. It is especially valuable when healthcare content must stay accurate, easy to understand, and aligned with the organization's approved material. Now let's look at use case 7, RAG for coding, documentation, policy, and compliance support. A third major RAG use case is support for internal administrative knowledge work. Healthcare organizations manage large volumes of policies, coding rules, billing guidance, payer rules, audit requirements, and operating procedures. A RAG assistant can help staff find the right policy, summarize the relevant rule, and answer operational questions with source grounding. This can support coding teams, utilization review teams, compliance teams, and revenue cycle teams. Instead of searching manually across folders and documents, users get faster, more relevant, and source-linked answers. This reduces search time and improves consistency in administrative decision-making. Now let's look at use case 8, agents for prior authorization, claims, and utilization review. The third bucket is agents for orchestrated work. One major use case is prior authorization, claims, and utilization review. An AI agent can read an incoming request, collect missing documents, retrieve benefit or payer rules, draft a response, route the case, and track status across systems. It can also summarize notes and suggest next steps for a human reviewer. This reduces administrative burden and shortens cycle time. It is a strong example of AI moving from answering questions to coordinating multi-step work. Now let's look at use case 9, agents for care coordination and follow-up. Another major agent use case is care coordination. After discharge or after a critical event, many follow-up steps must happen in the right order. An AI agent can coordinate reminders, education messages, follow-up appointments, medication checks, referral tracking, and escalation for missed tasks. It can also bring together information from care plans, notes, and communication systems. This supports continuity of care across departments and across settings. In simple terms, it helps make sure the next best action actually happens. Now let's look at use case 10, agents for front door access, intake, and patient service. A third agent use case is front door healthcare operations. An AI agent can help with appointment booking, digital intake, insurance verification, form collection, patient triage questionnaires, and contact center support. It can gather information from the patient, update the right systems, and hand off to the right team. This improves speed and convenience for patients. It also reduces repetitive administrative work for staff. When designed properly, this kind of agent becomes a workflow assistant that improves both service and efficiency. Now let's look at final recap and closing. Let us recap the main idea. AI use cases in healthcare can be understood in 3 practical buckets. First, AI and machine learning for prediction help estimate risk, detect conditions, and forecast outcomes. Second, RAG helps generate grounded answers based on trusted healthcare content. Third, agents help orchestrate complex workflows across people, systems, and tasks. Together, these 3 buckets show how AI can improve clinical quality, operational efficiency, and patient experience in the healthcare industry. To wrap up, here is the key takeaway. You now have a structured overview of AI use cases in healthcare industry. Review the core ideas, connect them to examples, and revisit concepts like introduction, what this video covers, current trends in healthcare AI when practicing. If you can explain the idea in your own words, you have really understood it.